I'll concentrate on communal farmers, what we call the small-scale subsistence farmers. And currently, their main challenges is market access. And when I mean market access, is both the local market and also to the international market. Currently, communal farmers communal farmers in the OIE recognized FMD-free zone that are bordering commercial farmers, they do have better market access than those situated in the north of the veterinary cordon fence, or what we call north of the red line. And the markets available to those in the south are exactly the same as those available to the commercial farmers, but oftentimes they have to market through what we call the middleman or the speculator, and the prices are plus or minus the same that a commercial farmer would get because it's based on weight. And you'd find that communal farmers in those areas have had to adapt their farming systems to be in line with commercial thinking or farming as a business. So you would find that those communal farmers are actually moving towards looking at marketing as an incentive to earn an income, a living. Now, those of the veterinary cordon fence, the marketing opportunities are more limited, and also the type of livestock that you get in those areas, in the northern communal areas, are more the traditional Sanga cattle, and also the body condition of those cattle is not what the market prefers, and as such they fetch a lower price, but not because the pricing system is less. The pricing system is exactly the same, but of course if you're paid based on weight you will earn less. But there are those ingrained misconceptions or ideas that we are actually being paid less for animals north of the veterinary cordon fence. And also the problem is that area is what we call the foot and mouth disease buffer zone, and at the moment we have not applied to the OIE to reclassify that area, for example FMD free with vaccination. But both government and one of the donors, the MCA, we are trying to improve the animal health of that area, animal health status of that area, and as such improve market access. But of course there are a lot of intricacies, there are different scenarios as presented by Namibia. Is it the relocation of the veterinary cordon fence because of its political connotation? Is it relocation of the veterinary cordon fence northwards to the border of Namibia and Angola? What are the socio-economic implications of that? You've got land pressure, you've got the communal system, so you need land reform, or do you need land reform? Those are the questions. But one of the problems would be, or one of the things that need to be tackled, where it's currently a challenge, but it could be an opportunity, is if the socio-economic impacts of putting up a fence between Namibia and Angola, would that solve the problem? Will we still be able to market, or are there other scenarios? For example, compartmentalization in terms of creating biosecure areas. If that is accepted at OIE level for FMD, that could be an option. Have, like for example, certain ranch type systems, some farms fenced off with a corridor between Namibia and Angola, and have the same type of system on the other side. That could also then benefit the farmers. They'll be able to have different market opportunities. Currently the only market access that we have is to the South African market, but there's the issue of quarantining and extra freezing of the meat for 21 days, and a farmer only gets paid after the 40-day period. So as for the South African market, for example, a communal farmer would prefer to get paid immediately. So the informal sector is more vibrant. I don't know how much money they would get, but at least they're able to solve that immediate problem of I want money now. That's one area. The other area is that we as government and the meat industry have to go more intensively to go and discuss the benefits of actually marketing, because we could since independence, the veterinary interventions in that area has been, in my opinion, quite good. And that is why you have that more than 1 million plus animals are actually situated north of the veterinary cordon fence. But now the problem is offtake. what, these various scenarios that have been presented, commodity-based trade, we could introduce all that, but will the people be willing to market? Because, as you know, subsistence farmer, the primary goal is owning cattle and using cattle for draft power and not necessarily market-oriented. So if the different scenarios, possible scenarios, investigated, so that they can become opportunities, but also the communal farmer to also understand or have the same concept as the communal farmer south of the veterinary cordon fence. And as for marketing from the north to the south, the issue is not FMD actually, because the area has been historically free of FMD. So now what we're actually doing is following the technical process of having the area declared free with FMD free with vaccination or FMD without vaccination. The biggest problem is CBPP, and obviously marketing of live animals from the north of the veterinary cordon fence to south of the veterinary cordon fence will be a problem, because we have managed to eradicate CBPP and FMD from south of the veterinary cordon fence. In fact, the veterinary cordon fence was a disease control barrier. It was one of the barriers of disease control when FMD and CBPP were being eradicated from the south, moving northwards. So those are the intricacies.